Welcome to Inside Patient Attraction. I'm Colin Receiver, and today I'm super excited to be joined by Sean Bailey, who's our video production manager. Now, Sean isn't just a video production manager. He brings a wealth of experience and knowledge about crafting patient testimonials to use in your marketing to attract more and better patients into your practice. And then at the end, for those of you that stay till the end, I'm going to give you a little tidbit about my new book that's coming out soon. So stick around. Welcome onto the show, Sean. Great to have you here. Sean Bailey is our video team manager, and video is so critically important these days. Websites with video are 53 times more likely to be found on the first page of Google. And I think something like 300 hours of video is uploaded each minute to YouTube, which shows just the huge breadth of how much video actually gets used and uploaded in this day and age, how important it is. So Sean, why do doctors, why should they care about video? What's it matter to them? Why would they have any interest in doing video and putting it out there on the web in their marketing?
Well, if you think about it, video is a way for your patients to meet you before they even set foot in the door. As a doctor, if you have video on your website that shows your personality, communicates what you're capable of, and basically allows the patient to know that you can handle their particular issue, then you've already set yourself up for success.
You've become the expert in their eyes. You've built that trust level with the patient from just being the dentist, the commodity, to being the guy that can fix their problem for them.
Exactly, and even better than that, of course, videos, as a doctor, videos of yourself and your abilities are great. Mm-hmm. Videos from your actual patients are even better. If you have video on your site of patients that have received care from you, mm-hmm. successful care from you, and they're able to talk about it clearly and how it's affected their lives, that's the social proof that you need, really.
I mean, that's one of Cialdini's major weapons of influence. His powers of persuasion is using other people's endorsements to build you up, the doctor, the dentist in this case, as the expert in implants or whatever niche that dentist wants to be seen as the go-to guy in their market area.
Exactly. So really, patient testimonials are great, but the right kind of patient testimonials are what you are looking for to promote your service and your practices. Make sense?
It does. Well, let's hit the counterpoint to that a little bit. What's the wrong kind? What kind of testimonials don't you want?
So if you pick the right person, someone you like, someone you've offered care to, someone that's happy with your services, that's good. That's a good place to start. But ask yourself, what do you specialize in? What are your niches, more or less? And if those patients don't fit that, they're probably not going to be the best videos to place on your website. I can tell you, I was on a video shoot. The dentist his featured services were implants and I believe cosmetic cases like veneers, whitenings, mm-hmm. things like that. They brought us orthodontic cases specifically. And they were great testimonials, good people, but did not fit what he was trying to accomplish. So his clientele coming in was probably a lot different than what he was hoping to see.
Kind of hard to be the expert in implants and cosmetics when you're having a bunch of teenagers talk about orthodontics. Another one of Cialdini's weapons of influence. People want to be around people they deem like themselves. It's what I call the mirror effect. You look in the mirror, if your marketing speaks back to you, it's a fit, right? If I look in the mirror and see something I don't like, that's not the right fit. That's the wrong fit as the marketing or the practice that I'm looking to go to.
Exactly. So if you have those patients that mirror what you were trying to accomplish, mm-hmm. that's great. From there, we get more technical. We have the right person, we have the right message, and so the next step is making sure we have the right setup for a successful video shoot with them. You always want to start with sound. Does the room have any sound issues that I need to be addressing, or should I maybe shoot in a different room? Mm-hmm. It helps to just sit in a room and listen for a few minutes and ask yourself, do I hear cars going by? Do I hear noise in the next room? Do I hear air conditioning kicking on?
You're going to hear all that in the videos.
Exactly, yes. And really that's the next step is asking if you have the right microphone for the job. You and I have microphones that are close to our mouths. Hopefully our viewers can hear us nice and clear. If our microphone is too far back or we're using the microphone on the camera, for example, the distance from the subject is going to sound like a cave.
The absolute worst thing I guess I'm hearing you say is the doctor pulls the cell phone out and holds the camera up here and says, hey, tell me about your experience here, right? Because it's got bad sound, it's got shaky video, there's no lighting, there's no, the background's probably sitting in the dental chair itself. But even if you just fix the sound and use a microphone, that just takes it up one big notch is what I'm hearing you say.
Exactly. You're using a dedicated microphone for recording the audio, and it also helps to lock that camera off too. And even if it's your cell phone, setting it on a tripod or a stable environment and getting rid of that shaky cam goes a long way to holding a viewer's attention. I mean, people in Hollywood try to use the shaky cam, and if it bothers you as a viewer for a Hollywood movie, how much more does it bother you as a viewer for some doctor with the jitters,
So do you recommend doctors shoot their own patient testimonials?
I recommend doctors find the right patients and equip them with the right message, but when it comes to actually videoing the patients, bring in the professionals to do that. Bring in the people that are going to be aware of the sound in the room and the people that know how to set up best for that type of scenario, the people that are conscious of your background elements, your mic placement, your lighting placement, those things that you really don't have time to think about that someone else is better equipped to think about.
And of course, you are able to send your video teams here at SmartBox around the country that are equipped with lights and microphone, and they have all this experience not only on the technical aspects of how to shoot the video, but also on the storytelling aspects of how do you craft these powerful patient testimonials that are going to get you new patients.
Exactly. And really, we haven't even talked about the post-production side of things yet. We've talked about how to find the right people and how to set up for a successful video shoot. But after that, there's editing to be done. Those YouTube videos you're talking about, any of them that go longer than 3 minutes, they're probably getting turned off. Exactly. So nobody's going to watch something that goes on too long. So for any testimonial, unless you just nailed it, there's going to be some cutting. There's going to be some material that ends up on the cutting room floor, and someone has to edit that.
And then it has to be, of course, put on the website. It has to be optimized because websites with video are 53 times more likely to show up on the first page, but that doesn't mean you just get to drop the video on the website. You have to optimize it and upload it, and there's a whole process, I assume, that goes into that.
Exactly, yeah. So I guess the big takeaway is anybody can pull out their phone and shoot a video, but to actually make a video that someone's going to watch, that multiple people are going to watch and benefit from, that takes more effort than I think some people realize.
How much post-production editing time, if you have a 3-minute testimonial, how much editing time went into that?
If you think about it, that 3-minute testimonial was probably more like an actual 10-minute interview. So my team would watch through that 10 minutes and find the best segments, the ones that communicate what that practice accomplished for that patient, how that patient's life changed. And sometimes that's the beginning of the interview, sometimes it's later, but we find those pieces, arrange them in a way that tells a good story. Once we've arranged the story the way we would like, we would typically color correct it, add some music that tends to help hold a viewer's attention, and of course attach some information for the doctor's practice so they know who to call.
Cool. There's a whole process, a whole system accompanied with all of this, it sounds like.
Yeah, it's a system that really pays off well when you've got the right patient with the right message and the right people have arranged that for you. Then you've got the story you need to convince that person who has that particular issue in their mouth to come and see you about it.
Video is such a critical part of a dentist marketing presence and their online presence, especially for you guys that are looking for better patients, not just more patients. You've got to become that trusted expert in your market area. You've got to become the dentist that your patients look to as the go-to person, right? You've got to become the one that they know, they like, and they trust. And to do that, you have to have this incredible social proof. It's Cialdini's principles of persuasion, his weapons of influence. And leveraging patient testimonial videos will allow you to attract more and better patients with your marketing. I've got a new book coming out, The 4 Horsemen of Dentistry. It's going to show you everything about video, everything you need to know to defeat corporate dentistry, to grow your private fee-for-service practice, to attract more and better patients, and grow those silos, those niches within your practice to be big profit centers for you. Sean, as always, awesome to be around. Thanks for coming on to the show today, hanging out, sharing your experiences. I know the doctors are going to love it, and look forward to hearing from everybody out there on what they thought and input for the next episode.
Thanks, Colin. Appreciate you having me.
Awesome.